Well, if we looked at the average longevity, so the expected lifespan at the birth, we see that it's a little bit bound to the income. So the higher the income of the country, basically the longer life expectancy of those who are born in this country. Well, it used to be all the same in the past 2 centuries ago as well. Of course, the life expectancy was much shorter and the income was much lower, but the proportion somehow remains the same. And the proportion is driven by two factors. One of them is the infectious diseases. So what the risk factors that are outside aiming at the human health. And the second are the chronic diseases that are bound in 100%, well, absolutely almost 100% to our habits. So these are all the risk factors behavioral. And now for the past 1.5 years, we're dealing mostly with the pandemics. So we're saying, okay, well, the pandemics already killed, as we know, almost 5 million people, which is a huge loss. And we say, well, the pandemic is a big threat to our health, big threat to the health systems. When we look also at the measles, Ebola, and Zika virus that took around 200,000 lives in the past 5 years, so we see that it's a real powerful threat. But uh, uh, as I already mentioned, that now we are facing more contemporary or newer risk factors, because the old risk factors, which is the orange line, were undernutrition, indoor air pollution, water and sanitation hygiene, and these were the subjects that were aiming at our health and were really influencing the longevity, the quality of life, and so on and so forth, and also pressing the economics of the healthcare system. But now, for the past 20 or even 30 years, the behavioral risk factors are more important than any others, which is binge drinking, tobacco smoking, physical inactivity resulting overweight, and so on and so forth. So we have a huge change in risk factors, and we know, coming back to the subject of today's meeting, that smoking, as you see, is the second biggest risk factor for chronic disease development in the world. When you compare, of course, outside of the time of pandemics, when you compare the risk of smoking and the risk of infections, the risk of smoking is almost ninefold bigger than the risk of infection. So smoking takes 9 times or 10 times more lives than the infections do. Well, let's see on all the non-communicable diseases that take 40 million lives each year, with cardiovascular diseases being the leader, the leader killer, of course, with over 17 million, the cancers, well, 9 million, respiratory diseases, especially of the lower respiratory tract, around 4 million, and several others to follow. We know that we are now trying to fulfill the strategy of sustainable development goals of the United Nations. Well, looking at the goal 3.4, which is to reduce by 1/3 the premature mortality due to the non-communicable diseases, we know that we have the 6 factors that we need to focus on. And first of all, again, is reducing the tobacco smoke. There is a best buy list built to show investing in which of the factors, well, in defeating of which of the factors will bring the biggest gain in the future. So at the top of the list, oh, I'm sorry for that. At the top of the list, we have the dietary change. Well, the unsafe diet, putting together sugar, salt, and several others. So you have a 13-fold increase in your investment. If you invest $1 in health, you have a 13-fold repay in not even 20 years. Number 2 on the list is binge drinking. So defeating binge drinking will be the second best investment in public health. And the third one is smoking. Defeating the habit of smoking will bring us an 8-fold return on investment if we invest $1 today. Let me show you something that always stresses me when I think of that or when I look at that. Simply, when I look in my country, in Poland, at the expenditures and the loss of productivity due to the tobacco-induced diseases, I'm looking roughly at 7 billion Polish zlotys per year. But then, when I look at the exceed and VAT income of the budget every single year, I look at over 23 billion zlotys a year, which means that from the point of view of the Ministry of Finances, I earn 23 billion and I spend 7 billion. So I have plus 16 billion zloty a year budget. This would make me a conflict of interest if I have to choose biggest tax income or better health condition of the nation. So I think that this is something that we need to help the politicians with, because this conflict of interest, especially when we look at the cost, the most costly diseases due to death, disabilitation, and the amount of diseases, the number of people sick, is cancers, all the cancers. This is around $1,000 billion. And absolutely, these diseases, I mean cancers in general, are bound to cigarette smoking. When you see the two curves, one of them, the preceding one, is the one showing how the cigarettes used to be sold. So the amounts of cigarettes sold every single year. And then the red curve that follows by 25 to 30 years. This is the time span. So this is a time span of one generation. So we have a peak in morbidity and mortality from cancer diseases, which is absolutely bound time-wise and is strictly bound in physiology to cigarette tobacco smoking. Well, this 2 decade or over 1 decade delay is needed to observe the effect. So this is one generation gap, which is very typical for any prevention means, for any prevention methods that we are using. But we already know that we have ways to reduce the impact of cancer on the morbidity and mortality of the society, and this way to reduce the impact of this group of diseases over the economics, health economics, and the country budgets. Well, please look at the rightmost part of this graph. We see that the tobacco smoke induces induces cancer. Let's say it's at 100%, the highest possible rate. Then this is 10 zeros. Then we have the new products, including the heat not burn products, that are 100 times less probable to cause cancer process and cancer sickness than the original tobacco. Then we have several other products following, including e-cigarettes. So we know we do have a tool of harm reduction. The problem is that we do not use the tool frequently enough. Where should it be put in? When we have a doctor, we have patients, and the patients come to the doctor. Well, he has his regulations, he has his knowledge to serve the best he can the patient. Well, of course, the absolute prime is the primordial prevention, which means we start education with children, and in, let's say, 40 years, in 2 generations, we should be able to say, well, we defeated the habit of tobacco smoking. But this is going to take 40 years, and it's not 100% sure. Then we have the primary prevention, the primary prevention that we already making. So simply, we banning cigarettes. We put some financial pressure in excise tax, in value-added tax, and so on and so forth. Well, we try to act against the social acceptance, to create the social disacceptance for smoking. But if we lost in these 2 steps, so primordial and primary prevention, then all we can do and all we should do is the reduction of the harm. We have a Polish protocol, Polish document functioning, showing that the 4th step in supporting a patient to quit is to suggest heat-not-burn or other products that reduces the harm. And well, I leave you with this couple of remarks that I'd suggest we'll discuss a little bit later. Thank you for your attention.